Hi everybody, in this recording we will talk about the precede model. First of all, I want to tell you about the core processes in intervention mapping. Intervention mapping has these things called core processes that are used for every step along the way in intervention mapping. So every time you start a new step or task in intervention mapping, you should be applying these core processes. And they involve, first of all, posing a question. So for example, the precede model, which is the first part of intervention mapping, begins with the question, what are the quality of life concerns for a particular community? So you pose the question, then you brainstorm a provisional list of answers. So you think, oh, I wonder what the quality of life concerns would be for this particular community. The third core process is to review the literature related to the topic. Fourth is to review the literature for theory. So what does theory tell you about the question that you've posed? And then think about whether there's a need for new data. Do we know what we need in order to answer that question we posed in number one, or do we need to collect some new data? And then formulate a final summary of answers to the posed question. So again, these are core processes. They're used throughout the intervention mapping, and right now we're going to talk about how they would be used in the precede model. All right, and I just want to make a quick note about what I'm going to talk about in the lecture versus what you're doing in the project. I'm going to be talking about the ideal approach to intervention mapping with all the steps intact. For your project, you'll do an abbreviated version of intervention mapping. And in some cases, as you're doing your project, you're going to need to indicate what you would do if you had time and resources. So for example, you might say, well, there's new data needed in order to answer this question, and here is how I might do that, collect that new data. But you won't actually be collecting the new data like you would if you were really working at a health department or some other agency and you were really doing intervention mapping to develop a program. Step one of intervention mapping is a needs assessment. And there are 4 tasks. So intervention mapping has 6 steps, and then within each step it has tasks. And the 4 tasks for step 1 are to establish a participatory planning group, to conduct a needs assessment using the precede model, balance the needs assessment with an assessment of community capacity. We'll talk later about what that really means. And then link the needs assessment to program and evaluation planning by specifying desired program outcomes. The needs assessment, the point of the needs assessment is to provide a full description of the problem. So you want to provide as much detail and complexity as you can within the boundaries of the project. So meaning sometimes you can't do everything you would like to do. Maybe you only have a few months and you can only do certain things. Maybe sometimes you have 2 years to plan a program and you can do everything. So in the needs assessment, you want to fully analyze the problem, the multiple things that cause that problem, and the people who are involved with that problem. Now, I want to make sure it's clear that you shouldn't narrow things down before understanding the full picture of the problem. And that's why I keep saying, don't decide yet what your program is going to be because you don't know the full extent of the problem. And that's what step 1 of intervention mapping is going to help you with. This is what precede stands for: predisposing, reinforcing, enabling constructs in educational diagnosis and evaluation. I'm just going to leave it at that for now, and it'll become clear, I think, as we go what each of those terms means. Okay, so task 2 in step 1 is to plan and conduct the needs assessment using the precede model to analyze health and quality of life problems and their causes. And this is what the precede model looks like. And I will just say this is a little different. The way intervention mapping uses precede is a little different than what the authors of the precede model designed. And I think I have a slide later on that says something about what those differences are. But we're using this model, so you don't really need to know what the original model looked like. So you can see on the right side, you have quality of life. And the perspective of the precede model is that everything boils down to quality of life. We don't care about health unless it changes our quality of life. And health problems are caused by behavioral factors and environmental factors. And the environmental factors include anything outside the person. So it's not just the air and the water, it's also the people around us. That would be the interpersonal factors, organizational factors, community factors, and society factors. So all those are wrapped up into environment. And as I said a couple sessions ago, all behavioral factors and environmental factors are the result or can be controlled by people. So, and people have personal determinants that lead them to act in a certain way. So if, for example, if I smoke tobacco, which I don't, there are personal factors within me that lead me to smoke tobacco. It might be stress. It might be that I don't believe it's a serious health concern because my grandfather lived to be 100 and he smoked every day of his life. There are a number of things within me that lead me to, maybe I have an addictive gene that makes me addicted to nicotine, and these things contribute to me having the behavior of smoking tobacco. There are also environmental things that might lead me to smoke, like, for example, interpersonal things. If everyone around me smokes, then I'm more likely to smoke. If I go to certain locations where a lot of people smoke, like bars, that's going to make me more likely to smoke. If I have a job that's very stressful, I may smoke to get relief from the stress of the job. So those are all environmental things, and every one of those environmental things has people at the sort of root of it. So if it's people around me smoking, those people have their own sets of personal determinants that make them act the way they do, which creates an environment that I have to live in, or I do live in. Same thing with, let's think about the societal level. Right now we have tobacco taxes in place. We have no smoking in most restaurants, I think almost throughout the country. I'm going to pause for a second and answer my phone. Actually, they hung up. So at each of these levels, well, let's see, I was at the societal level and I was talking about taxes and what kind of things we have at the societal level that influence tobacco use. There goes the phone again. Okay, that's weird. It keeps ringing once and then stopping. So we, at the societal level, we have tobacco taxes, we have smoking, bans on smoking in public places. We have various different things, and all of those things were put into place by people. That might be voters, like in the case of tobacco taxes, often it's voters that put the tobacco tax in place. It might be restaurant owners, it might be legislative bodies like city councils and so on. So all of those things are controlled by people, and each of those people that influences the environment has personal determinants of their own that lead them to do what they do that affects the environment. So we always have personal determinants affecting both behavioral factors, that would be the behaviors of the at-risk person, and the environment that that person lives in. Okay, so we start the model with quality of life. So we're going from right to left as we build our precede model. Considerations of quality of life include an assessment of the general hopes or problems of concern of the target population, or actually this should be changed to say the priority population. So we have a community, and people in that community have hopes and dreams and things that concern them, and really it's really at the core of what do they want their life to be like. So there's a list here at the bottom of this slide of different indicators that might be used to assess quality of life. And there's things like absenteeism. So we in our society in general believe that education is something to aspire to, and that's why we send kids to school. And that's why absenteeism is a problem. So we might measure quality of life using absenteeism at school. Achievement, that's also a quality that people tend to aspire to in our society. People want to get higher education, they want to get a better job, they want to make more money, they want to achieve in various different ways. Aesthetics, that's what things look like, what's pretty. People want to live in a neighborhood, for example, that has positive visual aspects to it. Alienation, comfort, crowding, discrimination, happiness, hostility, teen pregnancy, riots, self-esteem, unemployment, welfare. These are all examples of things that are indicators of quality of life. And there's millions of other things that you could think of. So we start with quality of life, then we move on to health problems. So that's called the epidemiologic diagnosis within the precede model. And that's where we examine carefully the health problem that is affecting quality of life. So how do we define the health problem and the population that is going to be the focus of the needs assessment? Here are some basic questions. I won't read through all these. You can, about what we would want to know to define the health problem. So what is the problem? Who has it? We use things like incidence, prevalence, and distribution of the problem. I'm not going to go through all these. I'm going to let you read through those. But in this task within intervention mapping, the charge before you is to develop a fairly complete description of the health problem and the population that is affected by that health problem. And you have all, I believe, identified either a health problem or a behavioral problem. If you are starting with a behavioral problem, which would be something like tobacco use, I'm going to just, I don't think I can skip back and forth in here, but if we were to go back and look at the diagram of the precede model, we would see that behavior is in a box that leads to the health problem. If you are starting with the problem of tobacco use, which is a behavior, not a health problem, then you need to carefully define the health problems that are associated with tobacco use. So the one comes to mind right away is lung cancer and other lung diseases, but there are also other health problems that go with tobacco. So cardiovascular disease, for example, asthma. Well, I guess that's a lung problem. But anyway, so if you're starting with a behavior, you need to then say, well, why do we care about this behavior? It's because it creates this health problem, which then leads to this quality of life problem. Okay, so now we move back to the behavioral and environmental factors. We've talked a little bit about those already in a previous slide. And you can see that the behavioral factors can directly affect the health problems. The environmental factors can either directly affect the health problem or they can affect the behavior. So, for example, if I grow up in a family where everybody smokes cigarettes, then that may directly affect my health because I may have poor lung function because I was around secondhand smoke, but it may also affect my behavior by making me more inclined to smoke because everybody I see around me smokes. So that's why there's arrows going up from environmental factors to behavioral factors and then also across over to health problems. So the next task in the precede model, or a next step in the precede model, is the behavioral and environmental diagnosis. And this is where we identify the health-related behaviors and environmental factors that could be causally linked to the health problem. So if we're starting the model, let's say with teen pregnancy, then when we get to the behavioral and environmental diagnosis, we are asking the question of what is it behaviorally that leads to teen pregnancy, and what is it in the environment that leads to high teen pregnancy rates? So more generally, examples of behavioral and environmental factors would be things in the physical environment like water, air, and housing, things in the social environment, like whether or not the people around you smoke, whether you're getting social support, whether you have access to medical care, what the behavior of healthcare providers are, and so on. And then there's a list of various different kinds of behavior there. So here's a list of behaviors that are types of behaviors that is pretty comprehensive. Compliance. So if you're told that you should take medication, do you take the medication? Consumption. How much do you eat or smoke or drink? Coping mechanisms. That would be a behavior. Are you able to cope with stresses that come into your life? Preventive actions like do you get recommended screening tests like pap smears? Risk behaviors like tobacco or alcohol use, utilization of health care, and self-care. So do you know how to provide care for yourself, like I don't know, bathing comes to mind, but there are a lot of various different aspects of self-care, and it will depend a lot on whatever the health problem is that you're working on. Okay, identifying environmental conditions. So environmental conditions related to risk can be social or physical conditions that affect risk behavior. We've just talked about some, so I won't reiterate that. They can be indirect or direct, as I pointed out with the arrows. Environmental factors can be prioritized in terms of their importance and changeability. We're going to talk a lot more about importance and changeability later on, so I think I'll skip that right now. The basic idea is that some things are not changeable. So if we were to set out and say, well, we think air pollution is a big is contributing to the problem that we're addressing, we may have very little ability to impact air pollution on the short term. On the long term, maybe so, but maybe we need to get our program in place that can have an impact within a couple of years. We probably wouldn't try to tackle air pollution. So there's a flashing box that says interpersonal, organizational, and community and society. Hopefully you could see that little flashing box when you're looking at this. There's examples here. I've kind of gone through these already in previous slides. You've got families, peer groups, influential people like religious leaders or teachers or coaches or healthcare providers. You've got support from social networks. So is a person getting the kinds of of support from the people around them that they need to have a healthy lifestyle? And then examples of organizational environment. This includes norms, policies, practices, and facilities. I'm not going to go into detail because I feel like I just talked about this, but I'm going to pause. I'm going to stop here because this is now an 18-minute recording, and I know it's going to take a million years to upload it, so I'm going to stop here and I will pick up with the next slide in a separate video. See you soon.